Coming up on this edition of Being Well, our topic is Parkinson's disease. Dr. Manishkumar Gorasiya from Paris Community Hospital Family Medical Center will be our guest. He'll explain the nature of the disease and how doctors diagnose and manage it. We'll learn about the early symptoms and the 3 types of treatment options. That's all coming up next, so stay right here. Being Well starts now. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Dr. Ruben Boyajian, located at 904 Medical Park Drive in Effingham, specializing in breast care, surgical oncology, as well as general and laparoscopic surgery. More information online or at 347-2255. Rediscover Paris. Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center. Welcome back to this edition of Being Well. I'm your host, Lori Banks, and Dr. Gorasiya has joined us today from Paris Community Hospital Family Medical Center. Thanks so much for coming by.
Thank you.
You're new to the area and to the show, so tell our viewers a little bit about yourself and your practice.
Well, my name is, as you mentioned, Dr. Gorasiya. My first name is Manishkumar. Basically, I'm from India. I finished my med school back in India. I moved to States in 2007. And I did my master in public health from Florida International University, which is in Miami, Florida. After that, I moved to Chicago, worked for home health and a home physician group for a couple of years, and then I got into residency in family medicine in Montgomery, Alabama. I just finished my residency and I moved to Paris. Currently, I am a board certified family physician. My area of interest is especially in geriatric population and chronic medical problem in elder population. However, I see patients from all the ages.
All right, so we're talking about Parkinson's, and I was telling you that I had a gentleman come up to me in a local store and said, oh, you watched Being Well, you know, have you thought about a show on Parkinson's, because he has it. And we thought, well, we've never covered that before, so we've brought you here today to talk about the disease. Give us a little background on the nature of Parkinson's and well, where does the name come from, first of all?
Okay, so let me tell you first of all about this history. There was a person named James Parkinson. He wrote an article in 1817. He has published this article named Shaking Palsy, and at that time everyone knew about the symptoms of Parkinson. But long years, 4,500 years ago, back in Indian ancient medical system known as Ayurveda, they have mentioned about disease named Kampavata. It's in Sanskrit origin. If you break down this word Kampavata, Kamp is tremor, which is shaking, and Vata is slow movement, which is core symptoms of Parkinson's disease. And they used to treat with plant, and that plant name is Mucuna pruriens. And then scientists have worked on this plant, why this is helping with this disease, and they found to have levodopa, which is a mainstay of treatment of Parkinson's disease in current world.
Really? That is interesting. So is this a chronic disease, a degenerative disease? How do you categorize Parkinson's?
In medical terminology, we can say Parkinson's disease, which is also known as paralysis agitans.
Okay.
It is a neurodegenerative progressive disorder. Parkinson's disease is the most common cause of Parkinsonism.
Okay.
Parkinsonism is a syndrome manifested by symptoms of shaking, which is tremor, slow movement, which is bradykinesia, postural instability, which is poor balance, and stiffness, which is rigidity. So this constellation of symptoms is Parkinsonism. and
Okay.
Parkinson's disease is one of the most common cause of these symptoms. If we break it down for our viewers, we can say it is a brain disorder which mainly affects the movements, which over period of time it get worse.
Okay.
And as it get worse, it can also make person to have dysfunction of other brain function, which is learning, memory, and behavior.
So it starts with something like a tremor, something
Yes.
muscular. Is that how it
Yes.
typically presents itself? And then over time gets worse. So it is degenerative?
Yes.
Okay.
You can say, like most of the people is aware of osteoarthritis, which is again a degenerative disease. The same way, Parkinson's disease is a degenerative disease. When it start affecting your brain, certain part of your brain, it goes worse and worse.
So is it a message in the brain that's not getting to the right places, or what's kind of going on in a Parkinson's person's brain?
So our brain has certain area, we call it substantia nigra, and the surrounding area, thalamus. That particular area is responsible to manage the function of one of the chemical in the brain, we call it dopamine. And once after certain age, for unknown reason, if that area stop making that particular chemical dopamine, it can cause all these symptoms.
Okay. So in your practice, do you have any Parkinson's patients that you're treating right now?
Yes, I have. I start seeing nursing home patient, and they do have Parkinson's disease, and most of them are managed by me, and some of them are also see specialist.
Okay, so we're going to get into the treatment in just a little bit, but what is the typical age of onset? Who is more at risk for getting Parkinson's in our population?
Okay, let me discuss about how common it is in our world and especially North America. The prevalence is number of cases at particular point in time.
Okay.
The worldwide, the prevalence is 0.3%. For general population, aging people more than 40 years of age.
Okay.
And which is approximately 7 million. It increases with the age. If we assume that longevity will be increasing from this point of time, by 2030 it will be 9 million. And this is again worldwide. For North America, that prevalence is 100 to 200 per 100K people of general population aging more than 40 years of age.
So it starts, the earliest is it starts in people in their 40s or later in life?
It can start with at the age of 40. There are some of the cases who have Parkinson's disease before age of 40, but which is rare, and in that case, genetic factor is the reason, most likely. The mean age of diagnosis of having Parkinson's disease is 70.5 years.
All right. That's what was one of my questions. Is it hereditary or is it genetic in nature?
Genetic plays a key role. It's 10 to 15% of the time. If you ask the person with Parkinson's disease, in your family anyone has Parkinson's disease, they will say 10 to 15% of time that one of the first degree relative, they have Parkinson's disease.
Okay, so that's not, it plays a role, but it's not a major role like
That's
some
one
other.
of the factor. The biggest risk factor is aging.
Okay.
And then family history. Then there are other factors which is not clearly showed in studies that they are the risk factor, but it's associated with risk factors are infection and some of the medication which can give the symptoms of secondary Parkinsonism.
So really, it's unlike a lot of other diseases we have, like heart disease and diabetes. They're kind of maybe not a lot that we can do to prevent this.
Yes.
Can't change our genetics, and we can't change getting older.
Yes, absolutely.
So let's talk about some of the early symptoms that people may see if they may be diagnosed with
Okay.
Parkinson's.
At first, the person with Parkinson's disease can have shaking. 70% of the time, when person comes to the doctor or person by themselves, they realize, they notice that they have shaking. Is 70% of the time.
Okay.
Other thing that Parkinson's disease can make patient move slowly.
Like walking slowly.
Walking, performing daily activities like buttoning their shirts or doing computer work or using mouse clicks.
Okay.
All these movements get slower. If they walk, they probably can be dragging their legs and sometimes follow steps very slow and kind of shuffling gait, we call it.
All right. So when should someone see their doctor if they're suspecting that, gosh, I may have this?
Okay. Now, as I mentioned, that patient can have shaking and slow movement, but before that, sometimes patient may notice or not notice, feel that internal shaking of the limb.
Okay.
But it's not noticeable. Patient cannot see, other person cannot notice, but patient may feel that.
They feel it inside.
Inside.
Okay.
That it's shaking. One another thing that comes before this is inability to sense or smell.
Okay.
That smell can get diminished before all these symptoms appear.
Really?
But it's difficult for person to realize. Once patient start having these symptoms or they have any concern, they need to discuss with doctor that they are having these symptoms that might be Parkinson's disease or something else. And they also need to think, okay, one of my family member has like Parkinson's disease, though, so I'll be having increased chance of having Parkinson's disease. So once they realize, okay, something is going wrong, they need to come to doctor. Then doctor can do thorough general and neurological examination, goes through history, and go from there.
So they may see a family care physician. Do they often see some kind of specialist as well?
It depends the severity of the Parkinson's disease at the time of presentation. Some patient will be waiting until it progresses a lot. At that time, primary care physician always start on medication. But if patient and family insist and doctor thinks, okay, they need second opinion, then they can send to neurologist or a movement disorder specialist.
Okay.
I have one patient who is managed by a neurologist.
Okay. So is the prognosis better if it's diagnosed early and the treatment starts? Because it is a degenerative disease, but can you slow it down a little bit?
Unfortunately, there is no medication available which helps to slow it down.
Okay.
We do have a treatment option available just to control the symptoms.
Okay. All right. So what kinds of medications do people take if they have Parkinson's?
The treatment wise, there are three choices available at this point. Number one, I would say non-pharmacological measure. Number two, pharmacological measure. And number three, surgical intervention.
Okay.
Non-pharmacological measure contains once patient has been diagnosed and patient and family education. So once patient is diagnosed and he knows, okay, he has Parkinson's disease, that will be frightening for any one of us.
Oh, absolutely.
So knowing about the disease and treatment choice availability, that would make patient calm and that would be always beneficial. Second thing is support group.
Okay.
Support group will provide family and patient to interact with other patients and their family, how they were doing, what they have done, what things needs to be taken care of. Third thing is physical exercise.
Okay.
That will be a preventive factor as well. As we discuss about risk factor, I forgot to mention about preventive factor. That's one of the preventive factor, that regular physical exercise can decrease the risk of having Parkinson's disease.
Okay.
Again, once you diagnose with Parkinson's disease, and if you do regular physical exercise like swimming or brisk walking, that will decrease your symptoms of rigidity and poor balance. Nutrition can help. Later in stage, Parkinson's disease can have patient constipated. So if you eat high fiber diet, that can help with
that.
constipation. Also, they have like slow response. They have decrease in judging of the distance, so they are not safe driver. So that needs to be reevaluated.
Okay.
Home environment needs to be evaluated for like rug or cluttered
So there's-
furniture.
Yeah, nothing in the way that
Yeah,
they might
good
be able
light
to. Okay.
and grab bar in the shower. So all these factors consider and is a part of non-pharmacological measure.
Okay.
If we consider pharmacological measure, there are couple of medications, mainly levodopa and dopamine agonist, which is pramipexole, Requip, which is a brand name for another medication. It's and other medications as well, apomorphine, which is available IV. So we have like it's available in PO form, like oral form, topical form, and IV form.
Okay.
So mainly we start with levodopa and dopamine agonist. There are other medication as well, MAO inhibitor, amantadine. So and it depends at the time of presentation and diagnosis, depends on age, severity, and how active patient is. Doctor and patient can discuss about medication and side effect. We can start on one medication and we can add another as well if patient needs it.
All right. And then the third option is surgery.
Surgery. Currently, that surgery we call it like deep brain stimulation. How they perform it, patient must have one surgery, brain surgery, to put that wires in some part of the brain which controls the movement.
Okay.
So once those wiring has been done, they will connect those wire to one device, which usually they put beneath the collarbone. And then that device can control the excessive involuntary movements.
So it's not curing it, it's
Yeah.
subsiding the
Yep.
symptoms. Okay.
Yes.
How long do people, what is kind of the progression? So if you're diagnosed, in some people, does it progress really fast? In other people, slower? What have you
Yes.
seen?
The progression varies with one person to another person. For example, as disease patient diagnosed with Parkinson's disease, it's in mild form. As it get worse, patient's daily activity will be compromised. At that point, we can say patient's functional status is impaired. As it further progress, it will be worse at a point that patient need assistance from other people for the daily activities, and we can call at that stage as disability. From impairment stage to disability stage, it varies from 3 to 7 years.
All right.
And mean survival age from the diagnosis of Parkinson's disease is 6 to 22 years.
All right. So,
Yes,
that's
it
a big
varies.
range.
Yeah, so
right.
it varies from one person to another person.
What eventually, as people, it's not a disease that can be cured. Do people succumb to the disease eventually, or what happens in its later stages?
Unfortunately, at this point, we don't have any medication which can cure or slow the progress. But researchers and scientists, they are working on it. So I hope they will find something. But as disease progress, patient can have non-motor symptoms which is not related to movements like anxiety, depression, psychosis, which can be because of Parkinson's disease or long-term medication side effects.
Okay.
They have sleep problem, they have walking problem, they will be bed bound, wheelchair bound, and the cause of death with patient of Parkinson's disease is when this disease will hit the muscle of their lungs, which is slow movement. If lungs is not functioning well, patient cannot get enough breathe in and out, and that can be a dreadful event. Another complication can be that over period of time, as disease progress, patient has difficulty swallowing and increased salivation. So if patient has difficulty swallowing, sometimes they aspirate some of the food particles, they have pneumonia, and it leads the sequence of complications.
So you may the Parkinson's can cause other things to happen.
Yes.
Okay. You had mentioned, I should have asked this earlier, does it happen more in men or women?
Yes. The study says that men has higher risk of having Parkinson's disease than women.
Okay.
And smoking exposure, research has mentioned that is associated with decreased chance of having Parkinson's disease.
Yeah.
Same as coffee and caffeine intake. It decreased chance of having. So smoking, coffee, caffeine, and regular physical exercise, those are protective factors, but I still say do not smoke.
Well, yeah, there's many reasons, as we've done many of these shows, smoking and caffeine and physical activity and all those things, they can, if you don't do those, they can help stave off other diseases as well. Is Parkinson's sometimes misdiagnosed, or maybe, you know, the symptoms can mimic maybe something else?
Yes. As I mentioned earlier, that is most common cause of Parkinsonism.
Parkinsonism.
Yes.
Okay.
And there are so many other factors or reasons which can give you Parkinsonism. Most common reason after Parkinson's disease is drugs. Like metoclopramide, which is nausea vomiting medication, antipsychotic medication. Person who has bipolar disorder who takes antipsychotic medication, they can have the same symptoms. Then infection, HIV/AIDS, neurosyphilis, encephalitis, all these factors can cause secondary Parkinsonism.
Okay.
Even heavy metal exposure like lead, copper, manganese, liver failure,
Okay.
that can give you symptoms of Parkinson's disease.
But that's not
That's not
Parkinson.
Parkinson's disease.
Okay.
It's symptoms of Parkinsonism, which is similar to Parkinson's disease.
Okay.
This patient does not get benefited from medication. Sometimes they do, sometimes they don't. Depends on why they have those symptoms.
All right.
And it's always been difficult to diagnose. That's why it is a clinical diagnosis is based on patient's history, sign and symptoms, and physician's evaluation based on general examination and thorough neuro examination. After that, physician can give a trial of medication. If patient gets better, patient has Parkinson's disease.
Okay.
Still, they do MRI of the brain to rule out the other causes of the disease, but MRI does not help to confirm diagnosis of Parkinson's disease.
Okay. In this last, we got about 30 seconds left. If someone's watching and maybe they have a parent or they themselves think, oh boy, I may have some of these symptoms, what should they, when they make their appointment to see their primary care doctor, what kinds of things should they be asking and bringing up so that can help you as the doctor move the process along and help them find out if they have it or not?
First of all, once they are concerned about having Parkinson's disease, go see primary care doctor, discuss what's bothering you, and then go from there.
Okay.
Also ask questions about once you are diagnosed, that medication option, when to start medication, and do I need to see specialist or not.
Okay. All right. But early diagnosis, and make sure you ask those questions of your primary care doc.
Absolutely.
All right. Dr. Gorasiya, thank you so much for being on our show, and welcome to Central Illinois.
Thank you. It's a pleasure having me.
Thank you.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Dr. Ruben Boyajian, located at 904 Medical Park Drive in Effingham, specializing in breast care, surgical oncology, as well as general and laparoscopic surgery. More information online or at 347-2255. Rediscover Paris. Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center.